According to a report in 2019, India produces around 30,000 medical graduates every single year. Most students are approximately 18 years old when they enter the competitive field of medical education. Do we wonder about the health, specifically the mental health of these folks who voluntarily or involuntarily enter the grind?
When you came, after how long would you say that you started experiencing mental illness, mental health issues, and what did you?
So I think the day one, I can say day one. I when I went to the class, it has been said by our seniors that we don't do ragging here and we just do interaction. And it is said that this interaction period is necessary. That is what they say. It went up to the level where they used to slap. People had their counts ki like तुम्हारा कितना count है, and one person would say कि मैंने 50 थप्पड़ खाए हैं, मैंने 100 थप्पड़ खाए हैं, ऐसे.
The kind of duration that one has to invest in medicine is quite large. Like in other places, it will be kind of 3 years, and they will be shifting over to a different place. But in medicine, the MBBS students, like they have to stay with the same people or same environment for a duration of around few years, maybe 6 years, and then MD again 3 years. There is continuity. There is same type of people. Most of the medicine students and residents spend maybe more than 50% of their whole duration in a week. Like minimum is 50%. Sometimes people spend around 60, 70 or 80% of the time in hospitals and only 20% of time in the home or whatever activities they want to do.
For people with mental illness, it's like they somehow feel that they'll overcome it rather than kind of accepting the fact that okay, this is an illness, and there's somehow some sort of a fascination with fighting through the illness, which is very stupid.
So it is basically taken as a show of strength in a way.
Yeah, so it's like basically someone who is maybe doesn't have a leg and he's supposed to run in the wards like a normal doctor without the crutches. So that's how I would say.
Right.
Like that is like the story in almost, I would say, 80% of the students I have seen in AIIMS who have this illness. That they are bright, that's definitely there, but it's like because of the stress of studies and because they are meant to somehow gather all the knowledge from the books, then they become sick, and then because they become sick, they kind of go away from the studies even more because it kind of hampers learning even more.
And I think this was because you are sitting with a light group of students who are very intelligent. You are supposed to be good rankers, and you are supposed to be intelligent. That is what the definition is कि जिनका रैंक अच्छा है वो इंटेलिजेंट होंगे. But it's not कि जो आपका एग्जाम बेस्ड है वो ऐसे ही कंपटीशन बेस्ड है. It is not based on intelligence. यहाँ पे जो सब आया वो जरूरी नहीं है इंटेलिजेंट हो. तो एक वैसा पीयर प्रेशर स्लोली बिल्ड हुआ आई थिंक डे वन से ही.
First thing to be addressed in India, if we are thinking about mental health, is doctor-patient ratio should be increased not only for the service of the patients but also for the betterment of doctors. Here, this whole system is like everyone is worried about patient suffering, and they can understand how the patient is suffering and what are the things we have to do. And but at the same time, it is happening negating the fact that doctors might also suffer, and they should be more compassionate to a department should be compassionate towards its residents, and residents should be compassionate towards themselves. Like they have to understand okay, the patient can suffer, at the same time we can also suffer.